I think one would argue, and I think the research would support this too, though, that the incidence of concussions in rugby relative to like American football is actually pretty good in rugby's favor, just because of tackle technique and not having, the comfort blanket of having a helmet or a weapon on your head.
Welcome to the Next Level podcast. I'm your host, Scott Dickinson. Bobby Gragston is the head athletic trainer and physical therapist at USA Rugby. The rugby athlete is a lesser-known specimen in the United States, but Bobby sheds light on the interesting training practices, conditioning programs, and the injuries seen in the sport. We delved into concussions, tackling form, scrums, and how USA Rugby trains and rehabs the neck. Lastly, Bobby shares his advice to young clinicians and students interested in working in professional sports. Spoiler alert, it involves LinkedIn. Please enjoy. Bobby, welcome to the Next Level podcast. Thanks for joining us today.
Yeah, thanks, Scott. Thanks for having me.
So we had just been messaging recently, and you had told me that you had just got back from South Africa. Can you tell us about these travels?
Yeah. So South Africa, Cape Town, South Africa was the climax to our season. It was a World Cup event, 24 teams on the men's side, 16 teams on the women's side. So I worked specifically with the men's team, but our women's team, they were pretty successful, finishing fourth. And we had a bit of a tougher time, but young team finished 11th. But preparing now for the new season and Olympic qualifying year, and here in a few weeks we'll be off to Hong Kong. So yeah, wish us luck.
Oh my gosh! And then currently you're coming to us from Chula Vista, Southern California region, correct?
Yes, that's correct. So here with USA Rugby men's sevens and women's sevens, we train out of the Olympic training site in Chula Vista, California. So just south of San Diego and just north about 5 miles of Tijuana.
Very good. So you had been telling me off air that, perhaps the demands and the requirements of a physical therapist and athletic trainer in your shoes, for someone in your position who has to work internationally, it's very different than, or perhaps different than, someone who works nationally, or me as a PT in a clinic in Philadelphia, right? So would you be able to talk us through some of these interesting challenges or things you have to work around when you're working international with these teams?
Yeah, certainly be happy to. So typically what a season looks like is we 2 weeks on, 2 weeks off. So for just about every month of the year, I'm gone for 2 weeks out of the country. So that's interesting in itself. We don't travel with a team physician. So internationally, as you can imagine, it can get quite stressful at times when you're the only medical provider for a group of 13 to 14 athletes, where there's different rules and regulations relative to medical law, scope of practice. So the good news is each tournament does have a tournament doctor that we can lean on and depend on in the event of any like significant illnesses or significant injuries. So one thing to note, it's interesting because every provider has to be World Rugby trained. So that's different than, what you'd learn in school and physical therapy, athletic training, or even like getting your SCS as a physical therapist, because the demands of a physiotherapist in other countries are different than the demands of an athletic trainer or physical therapist that's with their SCS in the United States, in the sense that we learn a lot about airway management, example, putting in NPAs, OPAs. So that's probably
what are those?
Yeah. So those are different ways to open up the airway, whether it's through the nasal passage or through the mouth. So being able to realize, different emergent situations in which that may arise. But to be completely honest, the good news is I haven't ever had to, use that training yet, and probably won't have to outside of if something happens in training, because we're pretty taken care of on the road at different international tournaments, and they do a really good job of staffing the medical department appropriately for each tournament, so that there's multiple doctors and specialists on the sideline for these events.
It's good that, they have physicians on the sidelines for you there, but I still imagine it's still a little bit nerve wracking for you as the only provider that your guys or gals know, right? So they're going to want to be working with you. They want to talk with you. And then these physicians, they're might be meeting for the first time, right?
Yeah.
And so in the event of a serious injury, you are smack dab in the middle of that situation.
Yeah, and you throw in variables such as language barriers, et cetera, et cetera. The good news for us in the United States is most people speak English, but you can only imagine if you're coming from a country like Japan or it can get or one of the South American countries, it can get a bit dicey in trying to communicate with other medical professionals while you're on tour in a different country.
I can't imagine. So wow, you're traveling 2 weeks out of every month, and then you're in San Diego the other 2 weeks. And is that year round?
For the most part. So if all things go according to plan for this Olympic qualifying year, so we'll be leaving for Hong Kong, like I mentioned earlier, in a couple of weeks. Then we'll be off to Dubai the November 24th. And then from Dubai, we'll go back to Cape Town, South Africa. And then we'll come back to San Diego. We'll have a bit of a holiday break. And then in January, we head off to Sydney, Australia. And then from Sydney, we head off to Wellington, New Zealand. And then there's a European tour in February. And then we go off to Asia in March, and then stateside, LA and Vancouver in May. And if we finish top four, then we actually get 2 to 3 months off, which means we've automatically qualified for the Olympics. So fingers crossed.
Yeah. So you want that time off. That'd be good.
Yeah, be
wow.
Nice.
One, I'm impressed by your travel memory. That's a lot of locations in a row to remember in sequence.
Yeah, it's a lot.
Now, what does your job look like when you're back home in San Diego? So, are your guys practicing daily and you're just doing management of injuries? Are there post-op athletes that you're working with? Because with you being gone half of the time, post-op athletes must be managed outside of just you.
Yes, certainly. So right now I'll give you an example. So typically our week looks like Monday, Tuesday, we have training sessions. Wednesdays are typically an off day, and Thursday, Friday we train. So usually we'll have 2 sessions per day, actually. One being more of a skill session, and one more being more like a conditioning and actually like rugby session. We'll have Mondays and Thursdays typically are more like speed oriented, attack, offense oriented, and Tuesdays and Fridays being our big contact days. I have a few post-operative athletes, unfortunately, right now that I'm working with. I'm thankful to have the support of the United States Olympic and Paralympic Committee, because when I'm on site, I'm managing and I'm working directly with those athletes. But obviously I can't do, rehab from appropriate rehab where I want to be really hands-on and real critical of their movements when I'm in a different country. So that's where I have the luxury of leaning on some of the providers with the United States Olympic and Paralympic Committee to kind of help bridge that gap while I'm traveling until I come back and managing those cases. So tomorrow we'll have a morning session. We'll have a little recovery. Prior to that morning session, we'll have rehab, and then we'll have an afternoon session, and then we'll have another kind of treatment window. So it calls for long days, but I love it. I love being part of a team. I love being out on the field, love being out on the pitch. And it's what I'm passionate about and brings me joy. So
that's great. I just pictured you international, and then you're rehabbing an ACL stateside, and you jump on a Zoom call and you're working with that athlete, and one of your fellow colleagues is with you as well in person with them in Chula Vista. Is that somewhat accurate?
Sometimes usually what happens is I provide kind of like a big picture document of like expectations for different time frames based on tissue healing or whatever procedure was done. And I also have the luxury of working with uh, a provider that is kind of trained like I am in regards to our rehab background and kind of our approach to loading. So it makes it really easy on me where I don't have to, I never want to micromanage or be that person, right? But we see eye to eye, and it makes it easier for me to kind of bridge that gap. So
Yeah.
I kind of I'm a bit open and malleable in the sense that, like, hey, you're here at this level, you're working at this level. I'm going to let you do your job. As long as we're staying on this timeline and we're meeting these goals, we're checking these boxes. Here you go. So
Yeah. Perfect. So you said you travel with the sevens team as an outsider to the rugby world. I know that there's the sevens and the 15s, but that's really all I got. So if someone was curious about the sport and wanted to learn the differences, what would you tell them?
Yeah, so let me preface what I'm about to say with saying that I have never been around such a hardworking group of athletes in my career in any sport that I've worked in. I've worked in professional soccer. I've been in the NFL, and what these women and these men put themselves through, their bodies through, their work ethic, it's next to none. So um, I let's see.
Look, great. Can I pause on that for a sec? Why do you think that is? Why do you think that these athletes are working harder, putting themselves through more than other really well qualified athletes?
Well, I think this just comes down to the demands of the sport, right? Um, and I think too, in especially in the culture in America within the sport, um, you know, let's say if we were just in South Africa, right? I mean, kids are coming out of their mother's womb with a rugby ball, right? They grew up playing rugby. That's all they know. That's the national sport. That's what people love. That's all they know, right? In America, unfortunately, that's not the case, right? So truly, our athletes come from like a melting pot, right? I mean, we have guys that had experience in the NFL. We had guys that played soccer. We had guys that were really good wrestlers. I mean, it's like such a melting pot. And I think just bringing in, like, like, for example, wrestlers. I mean, some would argue that wrestlers are some of the hardest working people I know. And we have a number of
Sure.
wrestlers on our team. So I think just the work ethic that's demanded, and when people travel and they see what it's like in other countries, right? When stadiums are full, um, passionate fans, it's just they know that's what's expected of them is a work ethic like no other, and um, I think I really do think that's why, yeah.
So it sounds like a normal day is two different training sessions for your guys, right?
Yes, yes,
And you said you've worked in the NFL. Have worked a little bit in college sports. Uh, two a days are once a year for about 2 weeks, and
yeah,
that's that. And then
yeah.
it's once a day, if that, and it's usually very light. So, what do you think is the difference there? Why is that happening in
Yeah,
rugby?
so this segues perfectly into your question with sevens and 15. So sevens refers to the number of people on each team, right? And as does 15s. So the rugby I work in, which is the Olympic rugby, sevens, there's 7 people on each team, but it's the same size field as the field in 15s when there's 15 people on each team. So if you take a step back and really think, what are the implications of that? It's a more athletic game in the sense that there's way more space since there's less people on the field, right? So also there's the match in sevens compared to 15s is much, much shorter. So in 15s, there's two 40-minute halves, right? So 80 minutes. In sevens, there's two 7-minute halves with a 2-minute halftime. So
Wow.
it's nonstop. I
Yeah.
mean, you have to be fit to play sevens. Play doesn't stop. I mean, in worst case scenarios, a passage of play could go for, I mean, I've seen upwards to 3 minutes without any stop whatsoever. And that includes tackling, getting off the ground, sprinting, running, jumping, whatever, passing, right? So I think because of the demands of the competition, and to that point, there's typically 6 matches over a weekend and back-to-back weekends. So you have to be fit. Your capacity for work has to be phenomenal, and you have to be resilient. So I think to build resilient athletes, you have to train them, load them appropriately, and that's why we usually, for most days, have 2 training sessions in addition to whatever performance programs for lifting, upper extremity and lower extremity.
That is really interesting to think that the 15s game and the sevens game is played on the same size field. Right when you said that, I just imagined like 2-on-2 NBA basketball where there's only 2 guys on each team and they have that whole court to work with.
Yeah.
And then I'm assuming this is kind of where you're going, is these guys can't be big, brutish, slow people that you might see in the 15s. Generally, I feel like I've seen bigger dudes on the 15s.
Definitely.
The sevens must be a little bit lighter, more athletic, more cardio inclined. Is that accurate?
Yes, definitely. And I think you think about, like, physiologically what systems are being challenged more so in sevens. So that's something to even to think about in rehab, right? Because I have to know the demands of the sport that I'm working in. And so even like with the post-operative, cases I'm working with right now, I'm making sure, like, I'm being so critical and purposeful in my programming, in the sense that you only have a certain amount of time in between exercises, in between sets, and in between reps, because we have to, because you're going to be, modified in some capacity where you can't train fully, you can't have this stress, you can't have that stress from performance, but you can have it from rehab. And we're going to do everything we can to make sure that those systems are stressed appropriately. So when you do come back, bridging that gap, which is always like the trick, right? Bridging that gap from rehab to performance isn't as big of a gap as we, want it, hope it not to be. So, yeah.
Sure. Do you know off the top of your head, like, for these guys, what kind of mile times are they running? Is that something that you guys are looking at? Because I imagine that is like a pretty good barometer for if they're in shape for rugby.
Yeah. So there's a big fitness test in rugby that is used as kind of like a barometer for fitness, or how fit you are in rugby, and it's called the Bronco.
Mm-hmm.
And it's typically depending on, if you're a 15s player or sevens player, male, female, there's different norms or expected values, right? Like any other fitness tests. So it's typically for our men, the expectation is that everyone runs this test in under 5 minutes, but it's all linear with 60 meters being the longest distance. And I believe every 5 to 10, like, having to come back. It's almost like a suicide in basketball, right?
Okay.
Yeah, but on the rugby field.
Oof.
And it's pretty treacherous. And so that's really the barometer of, like, seeing where someone is in regards to their fitness and their ability to play rugby at a high level.
So that is running suicides for 5 minutes straight, you're saying?
Essentially, yes. Yes, that's the best way to put it.
Oh God, that sounds so terrible.
It is terrible. It is terrible. But we have some really fit athletes, and I believe the fastest time this previous occasion was 4. So you want to try to get to a certain distance, right, covered, within getting back to the line. Initial line of start. So 4 minutes and 14 seconds, they were able to cover the expected meterage. It's remarkable, man. Remarkable.
And then it kind of reminds me of soccer where you have to run all around a really large field and you don't necessarily get as much breaks, probably even worse in rugby. But then with rugby, it's similar to football where these guys are massive and they need to be tackled and you need to break tackles, etc. So then I'm sure they're doing a lot of weight training on top of cardio training, correct?
Yeah, so there's each day, typically what it looks like, there's a couple days, there's programmed upper extremity lifts in addition to some lumbopelvic core, and also lower extremity lifts. And probably something we'll touch base on is also there are some cervical neck exercises that are programmed from performance to make sure that we also build resilient spines because
Sure.
as you know, this is a contact heavy sport, and that's important.
So are you yourself an NFL fan? Do you watch American football?
Oh yeah, definitely, man. I grew up in Louisiana. Grew up playing football, so yeah, I love football.
Okay. So yeah, I was just watching some YouTube videos because I love to watch the difference between the biggest hits in the NFL and then the biggest hits in rugby. And the tackling form is really different. Would you mind talking us through what you've seen and how that translates to injuries or lack thereof?
Yes, great question. So definitely, in my experience, right, my experience in rugby isn't long. It's only been a couple years, but there is a much more of an emphasis placed on tackle technique in rugby relative to American football. At the beginning of each contact session or contact day, so there's a ample amount of time spent on tackle technique, right? So there'll be, maybe two large pads set up in a grid where one person has the ball and the other has to tackle them, and there's a lot of emphasis on like no one's trying to kill anybody, but if you don't have your head on the right side, you're not getting low enough, then there's going to be a problem, right? Because I've seen, unfortunately, in cases in rugby where if you're trying to tackle high or you have your head on the wrong side, it's not going to end well for you. But in that sense too, much like the NFL has gotten better about penalties with different hits. One big thing in rugby is high tackles, right? There's no high tackles, and if there's a high tackle, it's a penalty, and it very well could mean a yellow card, which means you're sent off for in sevens at least 2 minutes, and then or you're red carded and you're out of the match entirely, which obviously is not ideal. So, but the biggest difference is the amount of time spent on actual tackle technique.
A couple of things I have questions on. What is defined as high tackling? Is that nipple line and above, or is that waist and above? Like what's high?
Yeah, really, and from what I've seen, and with any officiating, it's always open to interpretation, right? And sometimes they miss it, sometimes they don't. But if you're staying really below chest level, then you should be fine, right?
Okay.
But anything near the head, they're calling it. They're calling it.
Okay, and that is to protect the runner, the guy with the ball.
Yeah, it's really to protect both of them. But yeah, because unfortunately, high tackles still do happen in rugby, and unfortunately, there's like pretty significant consequences to pay because there's not equipment. There's no helmets. There's some scrum caps. You may see guys wear those caps from time to time, but that's the biggest thing too, because in football, guys have helmets on, so they feel as though that they're a bit more safe. One would think. But in rugby, if you're running around without anything to protect your face or your head, you're going to think twice about where you're going to put your head,
Right.
or going head to head, right? Because obviously there will be dire consequences.
Right. And then you said tackling, you can have your head on the wrong side. What does that mean?
Yeah. So if you think about maybe you have the attacker, they're running with the ball on the pitch, and maybe they're coming from the defenders coming from the side, and they put their head maybe in front of the athlete, and maybe they're lower, and they get hit in the face or the head with the knee or something, right? Because again, it's happened where I've had to spine board an athlete because they were knocked unconscious because they got hit in the head with the knee that was driving as the attacker was running. So being like little things like that, right? Because it happens.
See, so there's the downside of having to tackle low, as you are very close to some powerful knees.
Yes, no, it's true and it happens, but I think one would argue, and I think the research would support this too, though, that the incidence of concussions in rugby relative to like American football is actually pretty good in rugby's favor, just because of tackle technique and not having, the comfort blanket of having a helmet or a weapon on your head.
Right. Yeah. Yes, the old spear that is the head. So I was just watching these rugby tackling videos, and from what it looked like is they're very much leading with like they duck their head to the side away, and then they're very much leading with their upper trap, shoulder, brachial plexus region. Yeah. And I was just thinking like, man, they take some pretty good hits there. Like the tackling form looks beautiful, but I still imagine that's got to put some serious stress to that upper quarter. Do you see injuries there as a result of good tackling form?
Yeah. Unfortunately, I have seen a number of like, brachial plexus, like traction injuries, right? To your point, the mechanism you just described. But also a lot of AC joint injuries, a lot of AC joint injuries too, because they don't have the shoulder pads really to protect the joint itself in collision or even landing on that shoulder.
Interesting. Okay, so then you said that concussion incidence seems to be lower in the sport of rugby, correct?
Yes.
Now, internationally, because there's not much talk of it nationally. Internationally, is there any talk of chronic concussions, CTE, all the stuff that we're worried about here for football and the NFL? Is there talk of that internationally for rugby?
Yeah, 100% there is. And, let's not be, I mean, rugby's had its issues, right, with concussions and, handling it, not the right way. Obviously, there's been a lot in the news with the situation in the NFL, but, something World Rugby actually just implemented, it's been a couple of months ago, is that in competition, no matter what, right? If someone is diagnosed with a concussion, automatically they're out for 12 days, no questions asked.
12 days. So that's 2
days.
weeks in the football season.
Yeah, 12 days. So,
One game gone.
Even in like for us, it has repercussions in the sense that, we like we're going to Dubai in November, right? And then we leave from Dubai and play the next weekend in Cape Town. So that person is automatically out that following week. But the thing, it's all done for player welfare though, right? And at the end of the day, like the athletes must be protected, and sometimes they have to be protected from themselves. So I think it's a reasonable response, but also too, there's different criteria in concussions and removal, from World Rugby standards relative to other sports. We have our Hawkeye, we have people watching the games, and obviously if they see anything that's concerning, they're going to have the player athlete removed. But also too, we have like criteria one evidence. So any reason whatsoever to suspect like an head injury. So, athlete has issues, trying to stand up, or they take too long to stand up, or they stand up and they start stumbling a little bit. That's considered criteria one evidence and automatic removal, no examination needed.
And then 12 days out.
Yep.
Okay.
Yep. No examination needed. So there's some differences from like an international sport or World Rugby relative to some domestic sports.
It reminds me of the recent scenario with Tua on the Miami Dolphins. Did you see this?
Yeah. Yes.
So in his scenario, he would have very much missed that following week where he took another hit to the head. He wouldn't have been able to play no matter what, right? In that.
That's correct. So him stumbling on that Sunday after the hit from coming to the ground would have been flagged as criteria 1, automatic removal. And he wouldn't have been available to play for at least 12 days.
Wow. It's interesting. All right. So that's concussion. So when your guys get concussions, well, firstly, how common is that for you when you, as the athletic trainer, how many times a year are you guys seeing these?
It's actually not that common. I've out of all the tournaments we've had, all the competition, training, et cetera, I'm trying to go off memory right now.
Yeah.
I think we had only 3 concussions for an entire calendar year, and that included multiple competitions. So we've actually been pretty lucky, or I wouldn't say lucky, but everyone's done what they needed to do. And I mean, people heed to the knowledge of the coaching staff and to the medical staff. I'm like, having some awareness around head injuries and things like that. So yeah.
Wow. So just 3. I keep wanting to compare this to the NFL, where I'd imagine the average NFL team deals with more than that, or the average Division I football team. You think so too?
Yeah. No doubt.
Wow, that's very interesting. Okay, so we have concussions. Then you talked a little bit about brachioplexus, the AC joint, which I thought was really interesting because it makes sense. They're just going to take some serious blows to that region. What other areas, like maybe you could talk about the neck? What injuries are you guys seeing at the neck? Are whiplashes common? What kind of stuff do you have to deal with?
There are some whiplash type injuries. Obviously, the type of neck injury is more correlated to the position being played, right? So let's say in sevens you have your forwards and you have your backs. Really, that's how that's delineated in positions. So your forwards are the guys that, if you've seen rugby before, everybody kind of, they get together, they lock arms, they get around, and they it's called a scrum, right?
Scrum.
Yeah. So obviously a scrum in sevens is much smaller than that of a scrum in 15s because there's by default more players. So a lot of like chronic like neck and cervical injuries do come from scrums.
Really? Okay.
Yeah, really, because you can get some like forced hyperextension if like a scrum collapses. So I'm sorry, I'm like moving around right now, but so if the scrum collapses or falls to the ground, inevitably, their neck's going to be forcing a hyperextension, right? And that's a lot of force that's being generated. So you see injuries like that. A lot of times if you see the scrum starting to rotate or move around, that's a lot of force, like lateral flexion, forced rotation. You can get it from everywhere, man. It's pretty gnarly. And I got some numbers for you. Okay. I found some pretty interesting data in regards to like a 15 scrum.
Okay.
Of really how much force is being provided or developed in a 15 scrum. So I think the number was almost 3,000 pounds of force, right, in a 15 scrum, because there could be up to 16 people, or 16 people, sorry about that, up to 13, 14 people in a scrum. And assuming each person weighs over 200 pounds, which they definitely will, right? There's been some data to say that there's over 3,000 pounds of force being generated, which you think about, like, truly, our neck isn't really designed for more than being able to just hold our head up,
Yeah,
3,000 pounds. We have a sport where the demands of the sport, where there's that much force that's being just developed in a movement. It's pretty remarkable. So it's paramount that we as a staff, so performance staff, medical staff, make sure that there's things in place to make sure that they're ready to meet those demands, because if they're not, there's going to be some issues, as you would imagine.
Yeah, I always just assumed that scrums were tough on the neck, so it's really interesting to hear it from an expert. So, all right, so let's describe the scrum for someone who's not familiar. It is basically like interlocking a bunch of heads on
Yes.
opposing and your team, right?
Everyone's head is always to the left of the other person's head, and everyone's interlocking, and and everyone's pushing against each other. So usually a scrum happens after a penalty or a turnover. If you're familiar with soccer and set pieces, a scrum is more of like a set piece. So that it's a way to get everyone together. If you're the offense, you put the ball in a scrum, you kick it out, and it's a way to have everyone in so you can spread them out and get the ball outside and have a little more room to work with. Okay. So it's pretty gnarly to see in person, especially a 15 scrum. So a 7 scrum is just 3 people on each team in a scrum, right?
Okay.
But it's still pretty demanding. I mean, you always have like, oh man, my neck is killing me from this scrum that happened, or again, earlier, if a scrum collapses and someone next is forcing a hyperextension, you can imagine there'd be some kind of facet injury, or it's pretty much, so you have to be pretty creative in what you can do, and preventing these things, loading the cervical spine and other accessory muscles, and even when the injury does occur, being creative in how you're gonna combat that. So
yeah. So with the scrum, is that ever an axial load, or is it your head will end up going in one direction or the other, but not coming down from the top?
Well, it's typically not an axial load. There's not in that sense. Usually you'll get an axial load from like a head to head. And there's really, I haven't had any experience, luckily, with any like true axial loading in rugby. I think you probably see that more in football with the head to head collisions.
Gotcha. Okay. So I imagine with the scrum that the demands are largely isometric for the neck. So it lends itself to the question, what type of training, perhaps in the gym, are you guys doing for your athletes for neck strengthening?
Yeah, to your point, surprise, surprise, lots of isometrics. So you'll see a lot of banded isometrics, right, in varying directions. You'll see, you may have seen, well, there'll be some isotonic movements potentially with, you may have seen like the head harness, right? Other tools that we've had athletes utilize too, you may have heard of the iron neck. So we'll utilize that. But also recently, Scott, I really, not to plug you, but I love to use your device really in a lot of like preventative measures, and also to after injury. I think it's a good way to get guys moving too, in a more pain-free manner before we get to advance them too. So yeah.
So can you speak a little bit about, while you're on the topic, can you, like, what exercise are you guys doing with the NecksLevel? How do you use it? Do you use it with them supine, prone, both? I'm interested.
Yeah, so we do a lot of supine stuff. So there's one athlete in particular I'm thinking about. So I think it's really tough to provide an eccentric load to the tissues of the cervical spine, right? I think hey, I'm guilty, even as a young clinician, when I was working outpatient physical therapy clinics, really trying to come up with a creative way to load the cervical spine, right? Oh, I guess we're going to do some TheraBand rotations. I guess we're going to do some supine, isometric chin tucks. It just, gets really difficult to appropriately load the neck. And I think also too, to that point, people get scared to load the cervical spine, right? Because it's for some reason it's become this scary thing to load to a lot of clinicians, a lot of young clinicians too, right? I think that the NecksLevel is a great way, and I use it supine with some going with like rotation loaded isometric holds at end range, and then eccentrically like controlling that rotation back to neutral. I love it for that. I love it for instead of your traditional chin tuck, right, where we're able to manipulate the device in which they're able to do that traditional chin tuck, but
Yep.
they're able to hold it with some load isometrically, and then control that movement eccentrically coming out of it. So I could go on and go on, but for me, I think it's the coolest device that's been developed in regards to rehab and loading the cervical spine. I think it's so creative, and I wish I was a person that came up with it.
Well, thank you for saying that. It's that is great to hear. What do your players have to say? Because sometimes I worry that for someone who's such a beast, like I imagine you have some real beasts there. Are the resistance bands enough? Like, do they see any times where they're maxing it out? Have you?
No, it's definitely enough. It truly is, and I think really what the response goes is like people look at it, and they're like, "Man, what is this going to do?" And then once I actually bring them through the exercises and the movements, and they're like, "Oh my God, like this was way more difficult than I thought." Like I'm feeling a burn like I haven't felt before, or they come back and they have some muscle soreness. Like
Mm.
I think it surprises people to be honest, but I think that it's clinically feasible too, meaning like there's some things that exist and some things that we have. It's a bit cumbersome and trying to, you got to put it on the head, you got to do this, you got to do that. Whereas this is pretty, easy to use and easy to set up, and it's a bit more feasible than some other things out on the market.
That's awesome to hear. That's awesome to hear. Now, in the weight room, like, are barbaric neck strengthening exercises over? Are we done with those? Like neck bridges, putting significant weight, like the Floyd Mayweather chain around your
Oh yeah,
neck.
the head
Is that
harness.
stuff out of
Yeah,
here?
yeah. For the most part, man. I haven't really seen it here. I can't think of anything. I mean, really in performance, again, to our earlier point, there's a lot of isometrics in each direction, right? And two, to that point, really the stresses that come from like a scrum or the sport of rugby in itself can be worked on and trained actually in training sessions, right? So when you're actually going through the scrum, or you're going through the action of like how to scrum, or different set pieces, things like that, right? So you're getting some load and you're getting some stresses, some sport specific stresses in that capacity.
Out of curiosity, have you ever jumped into the scrum just to feel it out?
Oh my gosh. I have, and it was actually just a few weeks ago. And it's interesting, man. I mean, obviously I was in the scrum, so they knew that to take it easy on me. So I don't think I had the opportunity to really like get to experience what it's truly like.
Yeah.
But yeah, it's interesting, and back to an earlier point too, in tackle tech and contact prep, there is a lot of time spent on like grappling, right?
Mm.
Like I said earlier, we do have some former wrestlers, so there's a lot of time spent in like locking up, right? Perturbations, grappling. So that's another way to kind of like stress the cervical spine and other accessory joints and muscles to make sure that we build resilient rugby players.
It is so interesting. I spent a season with University of Pittsburgh football. So I was an athletic training student with them. And I remember in training camp and then throughout the entire season, I could probably count on one hand the amount of times that they tackled live. It was almost non-existent practicing tackling. And it made me think these poor guys got to go out onto the field on Saturday And then tackle, even though they've not gotten any preparation at full speed to tackle, but they're expected. And if they miss a tackle, that's a really big deal. So
Yeah.
it's really interesting to hear that rugby is, even for professionals, constantly improving technique, focusing on the technique.
Yeah, and we don't really stray away too much from contact and practice, man. Because again, like you have to, the nature of the sport and the demands of the sport, especially or specifically sevens for me. There's a lot of contact, and it's a lot of repetitive contact. So your body and your tissues, your joints, they better be used to those stresses on a consistent manner, or you after your first match or your second match or after the first day, people are already going to be really sore. They're going to be hurting. It's not ideal, but you're going to really be paying the price if you're not loading appropriately and you're not stressing the tissues that you need to stress to build resiliency and the capacity for work.
Yeah, yeah, it makes sense. It's so interesting to contrast that with the NFL week, right? Like where there's like they have the game and then there's several days off where they're like walking through practice. Like there's no intensity to it at all. Maybe they're lifting heavy, but to think that it's kind of like fighting in a UFC event back to back nights.
Oh yeah, no, I mean essentially that's what it is. I mean the sport of sevens, it's remarkable, man. I mean there's women and men that are playing with you know some things that people would think that they're injured, they have no business playing, and they're as long as they're strong, right? Nothing's absolutely contraindicated, and in my eyes they're able to protect themselves, right? Then crack on. But they're remarkable athletes, and they're really tough athletes too.
So you're coming to us from the Olympic Training Center, correct?
Correct.
If I read correctly, you didn't start with rugby there. You started with general multiple sports, perhaps.
Yes.
So could you just back us up? How'd you get into professional sports, specifically with Team USA, and advice along the way for people who are interested in your position?
I would love to, because I wouldn't be where I am today without people that didn't help me, or me making myself vulnerable and reaching out people and people deciding to take the time to answer my questions, answer my message. So yes, I'd love to. So I actually took a bit of a non-traditional route, in the sense that I went to physical therapy school first, graduated physical therapy school, ran an outpatient orthopedic clinic in Little Rock, Arkansas for a few years. And I simultaneously worked with a semi-pro soccer team. I then decided that, I wanted to work in sports. I wanted to work in team sports. I wanted to work with the team. So I was going to go and get my SCS, and I was doing the things needed to do that. And then I got some advice that I should look into athletic training.
Mm.
And so I did some research and decided, I think they're right. I'm just going to go back to school and get my master's in athletic training.
Interesting.
So I moved from Little Rock, Arkansas to Arizona, and decided to start the process getting my master's in athletic training at Northern Arizona University. And first year I was, well, to survive, I was still working some PRN work in a PT clinic while taking classes, also having to work at a high school in the Phoenix, Arizona area. Took out everything in my 401k, so I didn't have to take out student loans, and started over. And
Wow.
so did that. Second year, was at a junior college in Tucson, Arizona, where I worked with a variety of sports. You name it, I worked with it. During that summer, I had the opportunity to do a summer internship with the Denver Broncos. And so did that. And then after that experience, I was fortunate enough to be offered a seasonal full-time position with Denver after graduation. So I graduated that very same day. I drove to Denver from Arizona and got started. So
Wow.
yeah, I did that for a season, and had an opportunity to work in professional soccer as a head athletic trainer, and did USL. That was our COVID year.
Mm.
Got through that, and then an opportunity came open with the United States Olympic and Paralympic Committee here in Chula, and that's where I worked with a number of athletes: track and field, archery, our Paralympic track and field athletes. I covered boxing, and then I worked a lot with rugby, and that's where I kind of fell in love with rugby. And then after Tokyo, the opportunity existed for me to work directly with USA Rugby, and so I took that opportunity, and here we are. But advice I would provide specifically is during that all that time, I reached out to a number of people on LinkedIn, right, to try to ask questions, have opportunities, and there were enough nice people and friendly people to answer my messages, and for that I'm forever grateful. Some colleagues and mentors I had along the way that made themselves vulnerable and helping me and answering any question that I may have had. There's a number of people now that are working in the NFL or working in this setting or that setting, that I reflect back, and all that started was a message to me, because other people have the roadmap, right? Like I didn't create this route. Other people have blazed this trail before me to provide opportunities for someone young like me. And so I feel like it's really important to never ignore those messages. Answer those questions if you have time and you feel so inclined, but give back to your profession and give back to the young people that want to make it and want to have these experiences, because you never know how it's going to work out. And karma is a real thing. So if you're nice and you treat others well and you provide opportunities, it's gonna provide payback for you in some sense. So
Yeah, it's so interesting to hear your story and reflecting on me and how NecksLevel has grown. If I didn't have LinkedIn messaging, I would be significantly behind where I am today.
yeah,
Right? Like it's amazing, the cold calls.
I know it's that's what you got to do, man. Just I remember like some of the initial messages I would send out on LinkedIn years ago. And I'm like, oh my God, I can't believe I'm about to try to send this person a message. They're going to ignore me. What am I thinking? Like I'm way in over my head. And they would message me back, and they would be more than happy to hop on a phone call or a meeting or answer any questions via email. And now I'm giving a shout out to LinkedIn, because LinkedIn, what an awesome platform. Because I mean, outside of a colleague that we're both familiar with, I mean, that's how we've been able to connect too. So it's been great.
Yeah, just social media in general, it's so powerful to be able to direct message someone in this crazy high status position that you would otherwise have to write a handwritten letter to, mail it to their office, and hope that they read it.
Yeah.
But instead, you can send them an electronic message and it pops up on their phone instantly for free. It really is something to behold, and I encourage everyone to take advantage of that. And if I've learned anything from the sales process, is who cares if they don't answer? Who cares, right?
Yeah.
Like I'm sure you sent some messages that weren't answered. Who
100%.
cares? It doesn't matter, because a couple answered, and look where you are now,
Yeah, no, make yourself vulnerable. I think that's, again, with any young person or any young clinician, I was scared to make mistakes. I was scared to fail. And as soon as I got over being scared to fail or scared to make mistakes, that's when opportunities opened up for me. It's as simple as that. As simple as that.
Yeah, it's a good message, and probably a good message to end on. So, Bobby, thank you for the time today. It was awesome talking with you. Maybe we can do this again in a couple of years or something like that. So, thanks for your time.
Sure. Thanks, Scott. Thank you for having me, man.